spine or for the lumbopelvic mechanism. Manual therapy, when it comes down to this, is going to be a relatively small portion of what we have to do with these patients, right? Got a patient that comes in with back pain. I figure out where my job as a manual therapist is to search out the loss of movement, the hypomobile segments, whether that's lumbar segments, SI joint issues, thoracic issues, hip problems, whatever it is, whatever is causing this dysfunction, whatever's creating the excessive stress. That's my job as a manual therapist, is to search that out, wipe that off the map, give the tissues that are actually irritable, whatever those structures may be, give them the time that they need to heal. Okay? The body will do it. The body will heal them up just fine, but we have to open up this window where they're not absorbing extra forces and not continuing to break down. Okay, so that's priority number one, is we got to be able to be accurate in our diagnostic process, got to be accurate in finding our etiologies so that we can go about correcting those dysfunctions when we find them. Okay, so that's job number one. From that point on, my priority for the patient at home is to maintain the new range of motion that we just regained. Okay, now that could be any number of things depending on where the problem is. Okay, so if I have a loss of thoracic rotation or thoracic mobility, I'm going to give them some sort of rotational self-mobilization. Right? I think the one I showed you guys during the Module 3 class was the windmill standing against the wall. Right? So we'd stand in a stride position against the wall. Wall side leg is forward, and we're just going to rotate hand pressure into the wall and then bring it back to the front. We're just going to do repetitions of that. From my perspective, I want this to be a very habitual movement for the patient, meaning it happens a lot over the course of the day. So what I usually ask them to do is do anywhere from 8 to 10 repetitions of that every hour that they're awake during the day. Okay, some people kind of look at me like, that's a lot. And I'm like, how long does it take me to do 8 reps of that? About 30 seconds. So if you can't spare 30 seconds every hour to maintain that mobility, then it's going to be on you when it comes back, because that's a really simple ask. If you miss an hour, it's not going to be the end of the world. The problem was we used to ask patients to do like 100 repetitions a day, and they'd wake up in the morning and they'd do 100 repetitions first thing in the day, and then they'd go sit in a cubicle for 10 hours and never rotate again for the rest of the day. And it just was not carrying over well. So we're finding much better carryover if we have them do it sequentially over the course of the day, rather than just having them lump it all together in 1 or 2 big sessions. Okay? So again, that's an example. Depending on what we're finding, what the restriction was, we'll have to figure out other ways to help maintain that. Hip mobility, we would go in and if we say we have a UFR, we need to maintain hip internal and external rotation, so we find ways to manage to do that, right? Okay. Beyond that, that being our priority, as far as stability training goes, I have 3 distinct phases that I take patients through. The first phase is what we call a recruitment phase. The idea with this is that it's going to be used when a patient is in a pain state, right? When the back is actually painful. Okay, so if this patient has pain that's like above a 3, this is where they have to start. Okay, the idea is focusing on reflexive exercises, reflexive recruitment of the various musculature in order to get these things to function the way that they're supposed to function during the day. We talked about the transversus earlier and how I don't like using voluntary activation exercises for the transversus because it's just not how the muscle is supposed to function during your daily activities. So again, we're focusing on using exercises that are automatically going to get these things to turn on. Okay. With that being said, we have to then kind of isolate which muscles are appropriate to do this for. Right. Transversus is one of them. The lumbar multifidi is another. We will tend to have issues with glute recruitment, gluteus maximus recruitment. we will tend to have issues with, various sling muscles, that sort of stuff, right? So as far as like, as an example for the multifidi, my favorite exercise that I give for this is called a forklift exercise. And there's various positions you can do this in. In fact, in most patients that are in a pain state, I'd recommend them starting doing this in seated. Again, flexed positions are going to be much more stable for patients that are in a pain state. Yeah, I don't know who it is. Somebody's out there going to the bathroom a bunch of times. So the point being is that we want to use a position that's comfortable for the patient, right? And then progress them into a more dynamically unstable position. So seated is going to be the most stable. Kind of a half kneeling position would be kind of the next. Standing would be after that, and then into maybe a stride position, and then maybe a stride position with the heel raised on the backside would be less stable. Okay, so those are the things, the progressions that we would use with this. But all you need is a flat surface out in front of you. Okay, so I'll show you in standing because this is a nice, easy position for me to do it in. What we'll do is we'll take our arm and we'll straighten the arm out in front of us, nice long lever here. Okay, hook the hand underneath the surface, and then all we're going to do is we're just going to press up like we're trying to lift the surface up. So obviously the surface has to be very stable. You don't want something that you're just going to flip over. Okay, so we press up, hold for a count of 2 to 3 seconds, and then we alternate sides. Okay, and when I press with the left hand, it's going to facilitate multifidi recruitment on the right side. When I press on the right side, it's going to facilitate multifidi recruitment on the left side. I usually have them do a couple of sets, 2-3 sets of maybe 10 to 12 repetitions of this. Okay, this mimics the act of reaching out and lifting something. Okay, now if I reach out and I grasp this thing and I try and pick this up, but I don't have reflexive, automatic, and anticipatory recruitment of the multifidi on the posterior elements of the spine, my spine is going to collapse forward, right? So again, this is a very low load exercise, very low load, very comfortable for the patient to be able to find a position that you can put them in that they're comfortable doing this in, and it's very effective at improving reflexive recruitment of the multifidi. Okay, pain states around a vertebral segment tend to inhibit multifidi recruitment, right? And the problem with that is that the multifidi, from an anatomical perspective, it sits in what we call an osteoligamentous tube. So we have the vertebra. So if we're looking at, I wonder if I can do that whiteboard thing up here.
I think they have behind you, the other side. You turn around.
These things, this might have all been used. This one's open. Yeah, we don't need to do that. Yeah, we'll just do it on there. So what this looks like is if we have a vertebra, right? Here's our vertebra. We have the transverse process here, we have the lamina, and we have the spinous process. Coming over the top of this is the thoracolumbar fascia. Okay, so within this space is where the lumbar multifidi rest. Okay, when they turn on, they should fill this entire space, right? They should take up this entire space. So when they contract, what we should get is we should get outward pressure into all these surfaces. Okay? What that does is it actually compresses the articular structures together. So it's going to compress the facet joints, the articular surfaces of the facet joints together, and it's going to make the spine very rigid. right? It's gonna turn it into one thick mass that doesn't have a lot of mobility to it, which is great, very stable, very protected. However, if we have an inadequate size of that multifidi, as this thing turns on, it's not going to come anywhere close to putting enough pressure on that tissue to do that. Right? So inhibition and atrophy of the lumbar multifidi is a very real problem and a perpetuating problem. Okay? So when that sort of thing happens, we have to be able to improve the motor recruitment there to get that tissue to be substantial enough in order to fill in that space. Okay, so that's not going to happen purely with this recruitment phase, you know, with this type of exercise, but it's going to get it started in the right direction. Okay, so that's an example. Now they can stay. For myself in my clinic, I have an entire protocol written for this sort of stuff. It's a week long for the recruitment phase. Each day has a different routine to it. Okay, so there's a day that involves generalized recruitment, which this forklifting exercise is a portion of. There's some that are involved for functional activities like carrying. So we'll have weighted carries, different things like that, where they'll grab a small load, some sort of small weight, 5 to 10 pounds, something like that, and they'll just walk with it. They'll go do step-ups with it, things of that sort of nature. But these are very low-load activities, just focusing on automatic reflexive recruitment that occurs. Okay? They have to stay in this phase until the pain drops below a 3. Okay, so basically I would give them this and I'd say, go work on this, come back in a week, I'll check in with you, we'll see how things are going. If you're doing real well, if the pain's getting substantially better, then we'll move you on to the next phase. If it's not at that point, we say, okay, let's work on some of the mechanical stuff again. You're gonna stay exactly on that same routine. We're gonna do that exact routine again for another whole week. Okay, makes sense? After that, once this patient's pain is dropped below a 3, we're into a situation where we can start working on motor endurance. Okay? Most of the stabilizer muscles within the body, they're what we call postural muscles, right? They are on a lot. So they need a specific amount of endurance. So we want to focus on doing what we call tempo sets. So depending on, this is where I start working in those functional slings as well, as in this endurance phase. So for instance, day 1 on the endurance phase, we'll focus on the posterolateral sling. So we're looking at the glutes and the lats specifically. So I start out with, I want them to do some sort of compound movement that fires both muscles at the same time. So again, this patient's now in a situation where they're out of pain state, so we may have them do something like a bent over row, where they're half squatted to engage the glutes, and they're doing some sort of rowing motion to engage their lats. That would be the first exercise we'd have them do. And like I said, for an endurance phase exercise, we're gonna use what we call tempo sets. Tempo sets means we're just changing the duration of the repetition. Okay, so I typically will have them do 3 sets. The first set is going to be a 6 by 6 tempo, 6 seconds concentric, 6 seconds eccentric. Why 6 seconds? 6 seconds is about how long a burst of ATP lasts within a muscle. Okay, so if we burn through that, remember we talk about recruitment, how much muscle is recruited, how many motor fibers are recruited with a typical muscle contraction. It's about 60%. So if we burn through all the ATP on our first repetition of the first set, we have to transition over to the next group, that next 40%. Right, so then we know for a fact by the time we're done with this set, which is usually 12 to 15 repetitions at 6 by 6, we know that we've gotten 100% of the motor fibers functioning in that set. Okay. Second set, we change the tempo a little bit. We continue with a 6-second eccentric load, but now we do a 3-second concentric load. A 3-second concentric load is a pretty typical pace for a movement repetition, right? So if I'm doing 6 seconds down here with my arm, 3 seconds is about like that. So it's a pretty typical speed. Okay, then the third set, we change the tempo again. Now we're doing a 3-second eccentric load and a 3-second concentric load. So we're down to a pretty typical average movement pace. And that the purpose of doing that and going down in that amount of time is to make sure that the quicker movement isn't going to be irritating to the structure. This phase, the endurance phase, is 3 weeks long. Okay, it takes about 3 weeks to start seeing improvements in strength and or endurance. Okay, so 3 weeks is kind of the bare minimum for this. So the structure of how I put the week together is we will have day 1, posterolateral sling. Day 2 is going to be the anterolateral sling. Day 3 is what we call a mobility day. So for the lumbar spine, the 2 areas that are most likely to cause problems are going to be the thoracic spine and the hips below it. So mobility is focused on improving mobility or maintaining mobility through the thorax and through the hips. You can design your mobility day however you want. Day 4, so that'd be maybe a Thursday if you're starting on a Monday, is like an active rest day. So no specific loading, no specific stretching, go for a walk, do something active, go for a bike ride, do something useful, but don't overstress yourself. Day 5 then would be the deep longitudinal sling. So now we're looking at the hamstrings and the paraspinals. Day 6 then would be the lateral sling. So the hip abductors, gluteus medius, gluteus minimus, and the quadratus lumborum. This involves a lot of carries, asymmetrical carries. Okay, again, using tempo as we go through these repetitions. Okay. And a lot of times what we'll do is, especially if I have the patient working in the clinic with me, we'll do the 1 compound movement at that tempo, and then we'll do some accessory work for the individual muscles. So like for the first day, the deep longitude, not the first stage. For the first day of the posterolateral sling, we do maybe that bent over row for the, to contribute both the glutes and the lats. And then I might do an isolation exercise for the glutes. That's not a tempo activity. And then another isolation exercise for the lats, if I have them working in my clinic. If they're doing this stuff at home, we might just have them do the compound movement. Does that make sense? Yeah, okay. So 3 weeks for that. Once they're through the endurance phase, they're kind of 4 weeks, maybe 5 weeks, depending on how long it takes them to get through the recruitment phase. Once they're through the endurance phase, they're usually feeling pretty damn good. Most of them don't even want to bother going into the 3rd phase, which is always kind of amusing to me. They start to fall off the clinic, essentially. They don't come in because they're feeling real well, which makes some sense. The 3rd phase then is what we call a strength phase or a hypertrophy phase. So like we were talking about here, with that atrophy of the multifidi, we have to increase cross-sectional area of some of these muscles. Right? In general, and I can say this with 100% confidence because it's been documented on research for many, many years, patients that have substantial muscle mass tend to have less issues with instability, just because the muscles surrounding all these different tissues, they're thicker, they're more capable of absorbing load. Okay, so hypertrophy phase is focused on progressive overload. Generally, and again, we're going to use our sling mechanisms here to focus on these things because these are going to be the functional muscles that allow us to move through functional activities while maintaining stability. Okay, so again, stage one here, day one, I should say, not stage one, would be focusing on the glutes and the lats. What I tend to have patients do with this is I'll have them do what we call a volume day. So volume day essentially is we'll pick an exercise for the individual muscle, so say for the lats, and we'll set a timer for 5 minutes and say do as many repetitions as you can in 5 minutes of that exercise. So it's usually somewhere between 30 and 40% of the maximum that muscle, that particular group or that particular lift can be performed by that patient. So some patients may not know this sort of thing. Start them off relatively light. Okay, so for the lats, we may have them just doing some sort of like cable row, something along those lines. And we say, okay, I'm gonna start the timer, get going. Progressive overload then would mean the next week you have to do more repetitions. Okay, the volume has to increase somehow. There's a few ways to increase volume. Number one, we can increase the number of repetitions. Number two, we can increase the amount of resistance. Sense? Okay. So I go about the same distribution during the week. Day one is posterolateral sling, 2 is anterolateral. We have mobility days in there on day 3, rest day on day 4. Then we do deep longitudinal and the lateral sling, and then day 7 is always a rest day. So two full rest days in there, 1 mobility day, 4 quote unquote working days. Now, this routine that I have patients do, and like I say, I have kind of a protocol that I use for this, it's no joke. Like, it takes 20, 25 minutes to get through, and the patient is sweating by the time they're done. But to me, this is a means to an end. This is you gotta do this thing over the next 6 weeks, basically what we're asking, because realistically, the 2 phases that are gonna give us the most benefit are gonna be the endurance and the strength phase. It's the second 2 phases, phases 2 and 3. The recruitment phase you can skip over completely if the patient doesn't have significant pain to start out with. Right? So that's nice and it's a benefit. If the patient has a flare-up, say they're into week 2 of the endurance phase, and they come in and they're just like, I tweaked something, I was carrying stuff in from the garage, or I was working in the yard, or I was shoveling snow and something tweaked. Okay, jump back on that recruitment phase. We'll take a look and see what we can do with manual therapy by hand here. But get back onto that recruitment phase, and then when you're back down below a 3 out of 10, then you can jump back into where you were, and see if that's possible. If it takes several weeks for them to get back to a baseline, then you may have to start the endurance phase all over again. But it's dependent on your clinical reasoning how appropriate it is for them to restart that thing. Okay. But that's it. I mean, that's my routine as far as lumbar stability goes. I'm asking this patient to give me 6 weeks worth of time to get through this thing. Most patients are really only willing to give me the 3 weeks, because like I said, most of them, by the time they're done with that endurance phase, they're feeling really good, and by then they've kind of self-discharged themselves, and they're just not coming back into the clinic anymore, which is fine. Sometimes I'll email them or call them and I'll say, hey, I'm going to send you this. I'm going to send you the phase 3 thing. If you want to start working through it, then you can go through that, because it is a good idea. If you don't complete that thing and you don't improve some of that hypertrophy in some areas, that cross-sectional area, particularly of those multifidi muscles, odds are this is going to be an episodic problem, and it's going to come back at some point. Okay, so that's it. Any questions? Yeah.
What are some reflexive exercises you're using for TA? Like, I usually have people voluntarily contract it, so.
Yeah, so think about what we're looking at with the forward bending test. We know that should automatically turn it on. So I destabilize them a bit, I put them on 1 foot, and I have them bending forward. All right, so we call them hole-in-ones or bird dips or something like that. So it's 1 hand up here, and we're leaning down, reaching toward the floor. Okay. And the excursion that they get through may be relatively slim at first, but that's a good one. We can also have them do things like trying to lift something and then stand from a chair, if we need something just that's functional and not at very low load. Because what has to happen before we go from sitting to standing, transverse abdominis has to turn on. So if I actually lift something in front of myself, that's automatically gonna turn on multifidi. Multifidi is also a mechanism that should be looped with the transverse abdominis, so we should get recruitment of both. And then I can go from sitting to standing. That should automatically get that thing firing. But you can do all kinds of different things with that. You can have them lift something overhead and then go down to a kneeling position, come back up. Any of those sort of things should automatically recruit that. But you want to add a mild load. I would say nothing more than 5 or 10 pounds, because adding that load, and especially taking that load away from the midline of the body. So even if it's something like they have to lift a weight up overhead and then reach up and tap that weight on something, we should automatically be getting contractions of that transverse abdominis with that. You'll find that it's much more effective than having them just laying there doing abdominal hollowing exercises. I certainly have.
You said already 5 pounds. What you go to?
Say that again?
5 pound weight.
Yeah, I'd say it's somewhere between 5 and 10 pounds. It depends on the size of the person. You know, if I get a real petite person in the office and I think, 5 to 10 pounds is gonna be too much, then I'll give them 3 maybe. But I want enough load to make sure that the muscle's reacting to that load.
Yeah.
If I give them, 1 pound weight, it's just like, well, is that even really doing anything for them? Maybe it is, maybe it isn't, but that general range is usually appropriate. What else? Other questions about that?
If they're not reflexively getting it to fire, like if they don't have the phase 1, I forget if you told us yesterday, what do you do then? You send them out to like pelvic floor?
No, not necessarily. So if they're having a difficult time, so you're talking about phase 1 of the forward bending test?
Yeah, if they're not getting phase
Yeah.
1, so they're
No,
not
then
getting
the
that.
recruitment phase of this program is exactly what they need.
Okay.
We need to get that thing firing first.
Okay.
Because if I throw somebody into the endurance phase with a lot of time under tension, and they're not getting adequate recruitment out of some of these deep stabilizers like the pelvic floor, like the transverse abdominis, like the multifidi, they're gonna hurt themselves. Something's gonna go wrong. So that's kind of why we use this recruitment phase initially for at least a week, and looking at pain as kind of your tell for when you can kind of transition, that sort of thing, tends to be the most effective thing, because like I said, there's not a lot of other ways to kind of test for this stuff. With the forklift, you can actually have them palpate and feel for whether or not it's turning on. But you can always retest with the forward bending test as they start working through that recruitment phase. Because eventually, what you'd expect is you'd start having them bend forward. And you say, there it is. Now it's going. So once that's happening consistently, then you can say, okay, we're looking pretty good here. Same as any reassessment, right?
So you find that if you just give them a low load, they are getting that recruitment.
Yeah, like I said, the transversus is supposed to be an anticipatory muscle, so it's supposed to turn on before movement.
Yeah.
Right? So the idea is that we don't need any particular movement. We can use any movement that the patient can comfortably do. But adding a load increases recruitment of musculature by about 30%.
No, I know. I'm just, because the theory that I have been working under is that when they have pain, that you're getting less recruitment of that musculature.
Yep.
And then they're using their larger muscle groups.
Yeah, you're using global muscles to stabilize at a segmental level, yes.
But then, so those other ones aren't turning on as well.
What are you talking about? The more particular stabilizing
Yeah.
muscles? Yeah. Yeah,
But
that's the pain response.
You're seeing that they.
Well, the
with
key
lower
is
recruitment.
that if they don't have a pain response with the movement, so that's the whole point of picking a particular movement that they can do comfortably. So if they can do the movement comfortably, they should still get recruitment, right? But if they're doing a movement that hurts, then yeah, they're gonna have inhibition. The pain inhibition is dependent on the pain being there. Right? Anything else? Questions? What I'm gonna do with this stuff is I have some write-ups about the different phases. They're 2 or 3 paragraphs. It's not a huge thing, but I'm gonna condense that into just one document, and I can send it to Dave, and he can put it up there. I figured getting it ahead of time probably wouldn't help you guys look at it too much, but now that we've talked about it, at least it should help you kind of put together your own routines there. Yeah, and then you can kind of work through it. All right, any other questions with that? No?
Do
Time.
you mind sharing like some of your routines, some of your exercises? I know you
Um,
mentioned doing once or.
I haven't done that in the past, and the reason is because I sell it in my clinic
Okay.
for patients that can't get into the clinic, or for people that don't live in the state and they
Yeah.
just need something they can do at home. So I'm always hesitant to sell a revenue generating, or to hand out a revenue generating product, because the last thing I need is to see it end up on the Athletico website or something like that,
Yeah.
and then me have to.
Get it.
Yeah, intellectual property stuff is kind of the reason, so. I can kind of give you guys some examples, like I was saying. If you have particular questions, feel free to let me know
Yeah.
about different types of exercises or how to engage certain things, but, yeah, I don't usually give out the whole thing.
Okay.
What else we got? Any other questions there? No? Yes? Maybe?
Give it that look there.
What's that?